Have you heard of EMDR before?
I haven't. You've discussed doing EMDR, and I did EMDR.
Love it. Saved my life.
And I'm just wondering about that, what it did for you, how it helped you.
So I discovered something called EMDR. Yeah. Which
amazing
was the most healing. I was so scared to do it.
Okay, now what is that?
They use it for trauma and PTSD.
Is there tapping involved?
It can be tapping. It can be, I had the paddles.
Yeah, okay.
A lot of people, when they've had trauma, they do everything they can to not think about it.
The idea is that EMDR is accessing traumatic memories or other kind of unpleasant things in order to resolve them.
Welcome back to my channel. Hi everyone, my name is Alice. If you are new here, I am a licensed trauma therapist in the states of Ohio and New York. My work focuses on helping and centering Black women, especially first generation daughters, through coaching, therapy, content creation, education, and everything in between. In addition to that, I am also a PhD candidate studying resilience. So I'm busy. So I have been getting a lot of questions about EMDR. And there is a lot of conversations about EMDR in our media spaces. Recently, New York Times did an interview with Miley Cyrus, and Miley talked about her experience with EMDR. And we've had Prince Harry also talk about his experience with EMDR. And for me, I want more and more Black women to experience EMDR therapy, to consider it, because it's for us too. If you ask me, I think EMDR is one of the most compassionate, gentle, and kind way of processing trauma. And I will get more and more into what I mean by that. This is going to be part 1 of the EMDR series. So if you have questions, drop it in the comment section. You can drop it in my DM. If you don't want anyone to know about your question, drop it in my DM. And if you haven't subscribed yet, please subscribe so that when the subsequent videos come out, you will get to watch it. Okay. So the first question is, what is EMDR? Let's start with the basics. EMDR stands for Eye Movement Desensitization and Reprocessing Therapy. That's a lot, all right? Take a sip of water even for that. But don't worry, I am going to break it down for you. EMDR is evidence-based, so it is backed by a lot of research. There is EMDR, which is EMDR International Association. They do a lot of research on EMDR in different populations. So you can take a look at that. What EMDR does is that it helps your brain process, right, and digest traumatic memories that are stuck. And these memories can be from childhood, it can be from cultural or racial trauma, from big events to subtle events to everyday experiences that leave a mark on who we are all our lives. I said EMDR is eye movement desensitization, reprocessing. And eye movement, because when the person who invented EMDR first started, it was eye movement. But later, with a lot of research, it's not necessarily eye movement, but it's actually bilateral stimulation. So if we are to change the name, it could then be bilateral stimulation. But because the eye movement was what started at first, that is being kept. But what we are really using to process the trauma is bilateral stimulation. And what that means is that we are activating or stimulating both sides of your brain, or all aspects of your brain. The second question is, how does EMDR work? This is a very complicated process that I'm going to try and make it as simple as possible. Often I say that it's difficult to explain the process to people because there are so many mechanisms or brain mechanisms involved. I am a therapist, okay? I am not a neurobiologist or a neuroscientist, but there is a whole neurobiology and neuroscience backing EMDR. The foundational theory of EMDR is called the adaptive information process.
Are you sure?
Yes, AIP. I have to be sure I'm giving you the right information because I don't want to give you wrong information. It's called adaptive information processing. And the short explanation of it is that our brain is like a machine, right? It's like a processing center. Information comes in, your brain processes in the information, it sorts out the information. Maybe this information needs to go here, this information needs to go here, it needs to go that way. That is what it does. So it's like an assembly line where things are going. When things are working rightly, everything is moving through. However, a traumatic experience, it could be racism, it could be sexism, it could be somebody bullying you, it could be somebody laughing at you. That experience disrupts the system that is going on. It disrupts the assembly line of your brain processing that information. In EMDR, trauma is a subjective experience, right? What that means is that it is only the person who has experienced the events that can say that this is a traumatic experience for me. When you use that framework, you see that in EMDR therapy, you processing the trauma isn't necessarily about a forensic approach where it's like, okay, did this really happen? You have to get in there chronological order, because again, what EMDR helps us to understand is that trauma can distort memory, and so you may not remember every aspect of the trauma or in a chronological order. So when trauma happens, right, trauma freezes this process, or it disrupts the process where the traumatic experience can be stuck at some point of the processing unit. It can be stuck such as a memory, right? A negative cognition or a negative belief. It can be a body sensation. It can be an image. It can be a texture. You will be surprised the ways in which trauma is stuck in the brain, or how the brain associates trauma with a certain event. So EMDR works by using bilateral stimulation to help move the processing along. So the bilateral stimulation keeps your body in the present while also using your brain, every aspect of your brain, to process specifically. It can be a memory, it can be a sensation, it can be a belief, while processing that belief so that you get to process it, make sense of it, find meaning to it, or in whatever way makes it possible for you. Then you get clarity. It feels like a weight has been lifted off of you. Sometimes you get a different perspective of the experience. So that's what EMDR does. In addition to that, EMDR combines your body and your brain. Sometimes you use bilateral stimulation such as tapping. So that is also somatic healing, including your body, right? Part of the protocol is asking people, what are you noticing in your body in this moment, right? So then it forces the person to pause and to acknowledge what is in their body. During an EMDR session, you would identify either feelings, memories, thoughts that are causing you distress or that are causing any problems in your life. Oftentimes, if a person has done conventional therapy before, the therapist may ask them, where are you stuck in conventional therapy that you think we could use EMDR for? You would set goals based on that, and then that would be where you would start from. So I want you to think of this, right? The bilateral stimulation, let's think of that first. That could be like eye movements, like I said, tapping, or even sounds, right? Which help your brain to do what is already wired to do. So it's also a natural way of your brain healing. The second thing that I want to leave you all with is that think of the idea of when you eat, right? When the food is digested, it gets to go to other parts of your body for your body to use it. However, when something happens in the digestion system or processing unit, the food will be stuck somewhere, right? And sometimes it could cause pain. Sometimes you could cough. Sometimes you could feel uncomfortable. It's because that process didn't go through well. And that is what EMDR is, right? It's like a gentle nudge, right? Have you ever used a plunger, right? For the toilet? Maybe that's not a good experience, but when something is stuck in the toilet, it's overflowing, you use a plunger, you pump it, and then it flows smoothly. That is what EMDR is like, right? We can think of EMDR as that plunger that, you pump it down a little bit so that it will flow smoothly. So this is part 1. We will get more and more into it, the 8 phases of EMDR. What does it look like? Who is it for? Who does it work for? Who it may not work for as well. But like I said, I am on a mission to get more and more Black women to try EMDR therapy or to consider EMDR therapy. So if you have any questions, please leave them in the comment section or in my DM. If you haven't subscribed yet, please subscribe to this channel to support me. I will see you in my next video. Have a great day. If you cannot, do not go around ruining somebody else's day, and take care of yourself. If you can, please take care of another person too. Bye.